All right, greetings AP Psych students. Welcome to the video lecture for Module 73 out of Unit 13. In this module, we are discussing the biomedical therapies. These are techniques that can be used to treat some aspect of the body, including things like drugs and brain stimulation and psychosurgery. So let's start with drugs. First off, just the general term for drug therapy and the study of how drugs work on the mind. We refer to this as psychopharmacology. This field has really grown in recent decades as we look at the number of prescription medications that are available, especially in the area of psychotherapy, continues to grow. This is a very important field of research. We are going to take you through now a few of the different types of drugs. We're going to start first with our antipsychotic medications. These are drugs that are used primarily to treat symptoms of schizophrenia. As we know, the primary symptoms include the hallucinations and the delusions. So drugs like Thorazine are designed to help limit the amount of visual and auditory stimulation that one experiences, and can be effective for helping to control and reduce the number of hallucinations that a schizophrenic patient may endure. As with many medications, we are going to be dealing with, of course, some side effects, some very uncomfortable side effects. It can slow down one's effect in being overall. These antipsychotics can also impair certain mental functioning, cognitive abilities. Another symptom that's worth mentioning is the tardive dyskinesia, which can lead to involuntary movement of facial muscles and other muscles in the body. Keep in mind, we know one of the key contributors of schizophrenia is excess levels of dopamine. So Thorazine, as well as other psychotics, are designed to help regulate that level. And anytime you lower levels of dopamine, remember the subsequent disease we talked about was Parkinson's disease, which does involve involuntary muscle movements, the tremors. So this is a risk that one must face when dealing with these antipsychotic medications. Another form of medication we want to look at are anti-anxiety medications. These are medications like Valium and Xanax that are helpful in treating high levels of anxiety. So they are effective at relieving these symptoms, but can also have side effects including decreased coordination, reaction time, alertness, and possible addiction. One needs to be careful to avoid the pill popping phenomena that as soon as we experience some anxiety, we pop a Xanax or a Valium, and again, that anxiety may be reduced, but it can lead to addictions. So those are anti-anxiety. Another form of medication we're going to look at are the antidepressants. And we're going to look at probably the most modern form of these. They have gone through several phases since their introduction into society, but we're going to look at what we call the SSRIs. These are the selective serotonin reuptake inhibitors. They are effective in treating symptoms of depression as well as other anxiety disorders like OCD. The modern forms of these, the most common forms, are Prozac, Paxil, and Zoloft. They do have fewer undesirable side effects compared to earlier forms of antidepressant medications. The reason we call them SSRIs is because of how they work at the synapse. If you remember, here's our synapse between the axon of one cell and the dendrite of another.
Please call 5001. Dave Lisinski, please call 5001.
The pink circles here are meant to represent serotonin molecules. Here, of course, are synaptic vesicles. We know once the action potential reaches the end of the axon, the terminal button, that serotonin is released across the synaptic gap. It binds to the receptor sites in the dendrite, causing the action potential to continue. Well, what can happen in a depressed brain is that there is not enough of this serotonin that's being released and absorbed, leading to that depressed mood state. These green molecules would act as an SSRI, so a Paxil, Zoloft, Prozac, and basically block the reuptake, because normally what would happen when the serotonin is released, the excess amount would be reabsorbed, or that's the uptake, back into the axon terminal. Well, by creating this wall here, basically a damming effect, it basically is flooding the synapse here with serotonin, thus elevating the patient's mood. So that's why we call them the SSRIs. We can also look at mood stabilizing drugs like lithium. These would be effective in the treatment of symptoms of bipolar. Manic depression in particular is what we refer to this as. So just know that there are opportunities and drugs out there that are designed to help stabilize moods as well. And again, not as many side effects here as we might have seen in previous forms of the drugs. Now we want to look at another technique that can be used in the biomedical approach, and that's brain stimulation. In particular, we're going to start with ECT, electroconvulsive therapy, also known as shock therapy. What happens here is you have a scenario where enough electricity is run through the brain to induce a seizure. In the main area that it would be used in today is for severe depression. These are individuals who have tried a variety of medications, a variety of psychotherapies, and are not finding any relief. Oftentimes they're suicidal, and this is used as a last resort and may be helpful for the quick relief of symptoms until medications and other therapies may work. We do know that there are cognitive side effects, such as memory loss, that can accompany this technique. There are some doctors who rarely prescribe, others who consider it to be the only true effective treatment for severe depression. So there is some controversy with this, mainly also because we're not sure exactly how it works. We know that it more or less kind of reboots the brain. Maybe neurological connections that were off get realigned. But other than that, we don't have a lot of scientific proof of exactly how it works. Another form of brain stimulation is the repetitive transcranial magnetic stimulation, for short RTMS. Basically what you have here are repeated pulses of magnetic energy that would be sent to the brain through the cranium to basically help jumpstart again, kickstart a depressed brain. The advantage of this is you do not have the cognitive side effects like memory loss that you would see with ECT. Now let's look at the last form here of biomedical treatments. This is psychosurgery. These are surgeries that involve the removal or the destruction of certain components of the brain and brain tissue. Perhaps one of the most famous or infamous is the transorbital lobotomy. This is basically the destruction and severing of the frontal lobe from the rest of the brain. Walter Freeman was the man who popularized this technique in the United States. And between the 1930s, 40s, and 50s, there were tens of thousands of individuals that were lobotomized by Freeman and his followers. The more modern form of that is the prefrontal lobotomy, where this is the complete severing of the frontal lobe from the rest of the brain. Both of these left the individual with dramatic side effects, lethargy, zombie-like state, basically short of any cognitive functioning in terms of emotions, memory, problem solving. Again, today these would not be seen as viable techniques and would be seen as a last resort. We also have another approach here, the therapeutic lifestyle change. In this case, we're not really talking about medications. We're not talking about biological treatments such as psychosurgery or brain stimulation. Here we are looking at other lifestyle changes that can be made that do affect our physical functioning, but also in turn then can affect our mental functioning. The thought here is if we have a healthier body, we have a healthier mind. So, simple lifestyle changes such as increase of anaerobic exercise. We know that this can help stimulate cognitive functioning as well, emotional functioning, making sure we get enough sleep. In cases where we may have seasonal affective disorder, things like exposure to light. And again, if this is not natural lighting, the use of light boxes. Social interactions can also help stimulate cognitive function as well as positive thinking, and the use of nutritional supplements such as vitamins and things of that nature. So once again, these are your biomedical treatments. Hopefully this was informative for you. I will put a copy of this PowerPoint as well on Google Classroom. Thank you for your attention.